So Ken, tell me a little bit about your background and how you were injured.
My injury happened in February 15th of 2014. I was in a car, my son and I, and we got run off the road. Went out in the field, 65 mile an hour. The truck rolled a couple of times, went end over end. As a result of that, my son just had a couple of fractures, but I ended up with a broken neck, 11 ribs broke, 8 on this side, 3 here, my chest sternum, collapsed my left lung, broke my shoulder. I had stitches in my head and my ear, and I ended up with blood clots and that. So anyway, I was in the hospital for 3 months and waiting on a bed to get into Baylor in Dallas. And I spent 4.5 months up there in inpatient rehab. And then I had to go get another surgery, took the C7 out, put a halo on. So I had 4.5 months of inpatient, then I had 150 something hours of outpatient, plus self-therapy I did at a gym on the side, swimming in that. Since that, I've moved from Texas to Murfreesboro, and my sister-in-law and brother-in-law and brother told me about this H3O, and I started last Thursday, so this is my 5th visit, and within 3 days I've already seen results. And in 5 days I'm just progressing. The people here are fantastic. I enjoy coming. I look forward every day to coming. And the water therapy is something that's totally different because I've done a lot of therapy, a lot. And I've had some water, but mine was in the beginning of the injury. Now, 29 months into it, to be in a water therapy and learning how to use the resistance and the buoyancy for the exercises and the therapists that they have here working is just fantastic. Everybody is great, and I say H3O is the way to go.
All right, and what's the best thing that you've realized since you've been starting to come here that you've seen your improvements in?
I've seen the improvement because my left leg is my weak leg. And what I've seen is that I'm able to stand longer and better on that leg, and I'm able to come up. Normally what we do is we go down with our bad leg and up with our good leg because I have foot drop. So now I'm catching myself actually going up with my left and more so, and being able to stand more, being able to turn and do, the hip seems to be getting stronger. And I mean, it's just amazing. I would have thought, man, I'm probably going to need a week or two. I never thought 3 days.
All right, and how often do you plan on coming here for the next month?
Well, I'm planning on 6 days a week. I took Sunday off, and Sunday's the day I'm planning on taking off.
Now, you've been coming here every day for the past week except for Sunday.
Yes.
And has that been too much for you? Or what do you say to somebody who says, well, you know, maybe I only need 2 or 3 days of therapy a week?
Well, I will say this, that everybody is different and every injury is different. I've learned that. And you have to do what you think your body can do. But I would say if you would push yourself a little bit, you will find out that you can do an extra day or two if you really put your mind to it. You have to push yourself. No pain, no gain. There's got to be a little pain for that.
Speaking of pain, how painful is it to do your therapy in the heated pools?
You know, for me, it's not. It's not that hard. I mean, my biggest problem is with all the extremities up here. My nerves. I do have to take a break every now and then, but my mind and my body wants to keep going. So it's really not. It's not that hard for me to do.
Okay, thank you, Ken.
Yeah, thank you.